Holy cow, folks, some of the initial long-term data for a newer food allergy treatment called Xolair has been released, and I'm going to go over some of the pertinent information. Keep in mind that this is more preliminary because the data is in an abstract form. It's not everything, but when I learn more, I will let you know in the future, so let's get into it. So in case you're not familiar with this, there was a medication approved last year to treat food allergies called Xolair or omalizumab, which is actually a medication that was approved back in 2003 for asthma. It's just a different indication, and it's meant to help reduce the risk of having a severe allergic reaction if there's accidental ingestion. The study that got it approved was called the Outmatch study. It has three phases. Phase one, which I talked about last year, randomized about 170 individuals with peanut allergy plus 2 or more foods to either getting the medication or placebo injections every 2 to 4 weeks based on body weight and total IgE antibodies that were in their blood. And then after 4 months, they did food challenges to see how much protein they could consume that they were allergic to. And the majority of the individuals were able to tolerate a significantly higher amount compared to before the study started. The first 60 children who had completed stage one of the study, where they had Xolair injections for at least 24 weeks, had food challenges to see could they tolerate at least 600 milligrams of protein from the food that they were allergic to. And they found that most of the kids were actually able to tolerate significantly higher amounts, at least 8 grams in most cases. So 95% of children who had undergone the initial therapy could tolerate at least one of the foods that they were allergic to, and 68% of the children were able to tolerate at least 3 of the foods that they were allergic to. They then were told to try to consume these foods on a regular basis for a year. And over that time, fewer kids were able to tolerate the foods or continue eating them by 12 months. So after a year, only 80% of those kids were able to tolerate at least one of the foods they were allergic to, and 58% were able to tolerate at least 3 of the foods that they were allergic to. 10 out of the 60 completely stopped eating the foods that they were allergic to, and 2 of them had started oral immunotherapy to treat their food allergies. Now, it will take me some time to digest all of this information to be able to give you more informed information about it, but at this time, you should talk with your allergist if you want to learn more about this to see how this could potentially impact you if you are either on this medication already or are interested in potentially starting it in the future.